Members of the Economic Community of West African States, Ecowas, recently met in Abuja, the Nigerian capital, to deliberate on members' capacity in tackling the emerging transboundary animal diseases. The frequent emergence of zoonotic diseases heightens fears across the sub-region and calls for members to strengthen a coordinated surveillance approach. The Nigerian Minister of Livestock Development, Idi Mukhtar Meha, addressing delegates at the ECOWAS 10th annual meeting of the Regional Animal Health Network in collaboration with the German Dutch GIZ and other partners, said that the issues of transboundary animal diseases needed urgent attention.
In our pursuit to elevate standards of animal health, we must recognize that the strength of any services rely heavily on the capabilities, commitment, and continuous development of its human capital. We are all aware of the critical role that veterinary services play in safeguarding not only animal health, but also public health, food security, and economic stability. Yet, despite the progress we have witnessed over the years, human capital remain a pivotal element that must be enhanced and strategically developed and deployed to realize the full potential of the region's livestock sector.
The executive director of ECOWAS Regional Animal Health Center based in Bamako, Mali, Dr. Vivian Iwa, said the meeting brings together all the experts and professionals working in the field of animal health to assess transboundary animal disease landscape, to examine the issues and plan ahead to find solutions to problems of zoonotic disease across the sub-region. She added that the meeting would help professionals in the sub-region develop policy documents and present them to the minister responsible for agriculture and livestock in the ECOWAS member states for action.
Influenza, Rift Valley fever, and others that are threatening our livestock populations, reducing the productivity, and impact the food security. The climate crisis and increasing population pressure are further exacerbating these challenges, creating an urgent need for robust health systems. One of the critical barriers to addressing these challenges effectively is the shortage of well-trained and adequately resourced animal health workforce. Currently, Africa faces a shortage of veterinary services coverage, including veterinarians, veterinary paraprofessionals, and field diagnostic laboratories professionals, particularly in rural areas where livestock are most vulnerable.
Delegates from other countries at the forum emphasized the need for collaborations to strengthen members' capacity for surveillance in view of the fact that some members of the regional body face shortages of veterinary professionals.
For us, diseases don't recognize borders. And this is why a regional approach or a continental approach or a broader approach is always better, because that way one country can speak with the other on the problem that has arisen in that country. And if it's nipped in the bud in that country, it may not spread to your own country.
Because of this year's focus on human resources, looking at the prospects for the future in this essential area, we also address one urgent issue, which is how to respond to outbreaks and use the human resources that we have more effectively.
The meeting, which is expected to last for 5 days, will look at other issues including the extinction of donkeys and illegal trade in donkey products in the region. Annie T. Patrick, Core TV News, Abuja.